What if some of the food a man eats today could influence the quality of the sperm involved in a future pregnancy? Not the baby's eye color, not its personality, and certainly not its destiny. We are talking about measurable characteristics of sperm, such as concentration, movement, structure, and DNA integrity. Sperm cells are not simply produced overnight. Their development involves an extended biological process influenced by hormones, testicular function, metabolism, oxidative balance, and general health. That means reproductive health should be viewed as part of overall health, not as an isolated system. And now we reach the foods that appear most consistently in the research. Stay with me, because number 4 is often misunderstood. People frequently assume they should simply buy supplements containing the same nutrients. But food evidence and supplement evidence are not the same thing. Before this video ends, I will show you why taking more vitamins does not necessarily mean producing better sperm. If evidence-based health videos are useful to you, subscribe now, because we separate research from internet myths. First, fruits and vegetables. They provide vitamin C, folate, carotenoids, polyphenols, and numerous other compounds involved in normal cellular function. Research examining healthier dietary patterns commonly finds that diets richer in plant foods are associated with more favorable semen measures. Second, nuts. They contain unsaturated fats, minerals, and antioxidant compounds. Randomized research and systematic reviews have reported improvements in certain semen parameters among men consuming nuts. However, that does not establish nuts as a fertility treatment. Third, fish and sources of unsaturated fatty acids. Sperm cell membranes contain lipids, so researchers have investigated whether the types of fat consumed in the diet relate to sperm function. Some studies associate diets containing more omega-3 and unsaturated fats with better semen parameters, while diets high in saturated fats have sometimes shown less favorable associations. This creates an important distinction. The scientific question isn't simply, do you eat fat? It is, what types of fats dominate your overall diet? That difference is easy to overlook. Fourth, minimally processed carbohydrate sources, including whole grains and legumes. Their relevance may extend beyond individual micronutrients. Dietary quality affects metabolism, blood glucose regulation, cardiovascular health, and body weight, all of which form part of the wider physiological environment in which reproductive function occurs. Because what happens around your waist and inside your metabolism may matter just as much as what is sitting on your plate. Here is where the discussion becomes bigger than food. In the next 2 minutes, we are connecting body weight, metabolic health, and sperm quality. And after that, I'll show you the eating pattern researchers repeatedly associate with poorer reproductive health markers. Save this video now. Male obesity has been associated with changes in reproductive function, including alterations in sperm parameters and increased sperm DNA damage in some research. But weight itself should not be interpreted as the only variable. Hormonal regulation, inflammation, insulin sensitivity, sleep, and other health factors may interact. Some recent research has reported that greater intake of ultra-processed foods is associated with a less favorable semen profile, while Mediterranean-style dietary adherence shows the opposite association. Again, the key word is association. These findings support further research, not a claim that one processed meal causes infertility. Instead of obsessing over whether one particular food is bad for sperm, evaluate the dietary pattern. How often are vegetables present? How frequently are whole foods replaced by heavily processed alternatives? Where does most dietary fat come from? Is the diet varied or repetitive? Those questions are far more scientifically useful. Now return to the question in the title. Does a man's diet literally form the baby? Not by itself. At conception, sperm contributes paternal genetic material. Scientists are also studying how paternal health before conception may relate to sperm epigenetics and future offspring health. But human evidence is still developing, and many outcomes involve both parents, pregnancy biology, genetics, and environmental factors. And this distinction is exactly why the next myth can be dangerous. If sperm can be affected by oxidative stress, why not simply take huge doses of antioxidants? That sounds logical, but biological systems do not always follow the rule that more is better. In a moment, you'll see why supplement bottles cannot replace an evidence-based diet. Comment "Food First" if you want more videos where we test popular nutrition claims against clinical evidence. Trials have investigated zinc, folate, selenium, carnitine, coenzyme Q10, vitamins, and omega-3 supplements. Some studies report improvements in individual sperm parameters. But a 2025 systematic review concluded that there was no convincing evidence that dietary supplements improve male infertility overall, particularly when looking at outcomes such as pregnancy and live birth. This is one of the most important analytical points in the entire video. Improving a laboratory measurement does not automatically mean increasing the probability of pregnancy. Fertility depends on numerous male and female factors. Therefore, sperm concentration, movement, or morphology should never be interpreted in isolation. Nutrients are essential, but excessive supplementation can produce unwanted effects, interact with medications, or create nutritional imbalances. Someone with suspected infertility should not attempt to replace proper medical assessment with a shelf full of supplements. A more defensible strategy is remarkably ordinary. Eat a varied diet, make plant foods routine, choose whole grains and legumes frequently, include appropriate sources of unsaturated fats, select nutritious protein sources, and reduce dependence on heavily processed food. Not exciting, but scientifically more credible than promising a miracle ingredient. Nutrition is only one part of preconception health. Smoking, excessive alcohol intake, obesity, and exposure to certain environmental toxins can negatively affect fertility. The World Health Organization therefore recommends broader lifestyle interventions, not diet alone, for individuals and couples planning pregnancy. And this brings us to the biggest mistake people make when trying to improve sperm quality. Reproductive biology does not respond like a light switch. You cannot eat perfectly on Monday and expect an entirely different reproductive system by Friday. Changes in health behaviors should be viewed as sustained preconception habits rather than quick fixes. So if someone wanted a practical preconception eating strategy, what would it actually look like? For the next 2 minutes, forget supplements, superfoods, and viral fertility hacks. We're going to build a simple plate using what the research actually supports. And stay until 12:30, because I will reveal 3 signs that nutrition advice alone is not enough, and professional fertility assessment may be needed. Send this video to someone who thinks fertility begins only after pregnancy starts. Start with plant diversity. Vegetables and fruits provide fiber, vitamins, minerals, and a wide spectrum of phytochemicals. Instead of chasing one antioxidant, aim for variety. Different colors generally represent different groups of plant compounds. Next, add minimally processed carbohydrate sources, whole grains, Beans and other legumes can replace some refined carbohydrate choices while providing fiber and micronutrients. Think in terms of repeated dietary patterns, not perfect meals. Then consider your fat sources. Foods containing unsaturated fats, such as nuts, seeds, fish, and certain plant oils, fit the dietary patterns commonly associated with better cardiometabolic health and, in several studies, more favorable sperm parameters. Protein quality matters too. Instead of allowing heavily processed meats to dominate the diet, vary protein sources across fish, poultry, beans, lentils, eggs, or other appropriate foods according to individual nutritional needs. Now comes the part most people ignore. What surrounds the plate? Nutrition cannot be separated completely from sleep, physical activity, and general health. Whose current infertility guidance promotes healthy diet and physical activity alongside avoidance of tobacco as part of preconception and fertility care. But there are situations where changing the menu is no longer enough. Here are 3 situations where the smarter move is not another fertility food. It is proper medical evaluation. Number 3 is especially important because many people spend months experimenting with diets while an underlying medical problem remains undiagnosed. If you're finding this breakdown useful, subscribe and turn on notifications for evidence-based reproductive health explainers. First, an abnormal semen analysis. One abnormal result does not necessarily establish a diagnosis, but persistent abnormalities deserve professional interpretation rather than self-treatment with food or supplements. Clinical assessment can evaluate the larger reproductive picture. Second, known reproductive, hormonal, anatomical, or significant medical problems. Nutrition may support general health. It cannot repair every physical obstruction, genetic condition, hormonal disorder, or other medical cause of infertility. Third, persistent difficulty achieving pregnancy. The World Health Organization defines infertility as failure to achieve pregnancy after 12 months or more of regular unprotected intercourse. Evaluation may sometimes be appropriate earlier, depending on age, medical history, and clinical circumstances. If you remember only 5 things, remember these. 1. Prioritize overall dietary quality. 2. Eat a variety of plant foods. 3. Favor healthier sources of dietary fat. 4. Reduce dependence on ultra-processed foods. 5. Treat nutrition as one component of complete preconception health, not a miracle treatment. At the beginning of this video, I asked whether today's food could influence sperm involved in a future pregnancy. The scientifically responsible answer is potentially yes, but indirectly and as part of a much larger biological system. A man's health before conception matters. Nutrition is one modifiable component, but genetics, medical conditions, lifestyle, environmental exposures, and the health of both prospective parents also contribute.